All right, hello and welcome. My name is Amy Royer. I'm the project coordinator of the Rural Health Initiative. The mission of RHI is to engage partners to share ideas and expertise and to support communities in improving health while stimulating a higher level of wellness across the state. Thank you all for joining us for today's webinar, Building Active Communities Initiative, presented today by Cathy Costakis, Meg Tracy, and Chris Danley. Sorry, Chris. Complete. So thank you for joining us today. I will now roll the ball over to Cathy and she can get started.
Okay, do you see it?
Yep, you're good to go.
Wonderful. Well, thanks so much everyone for joining us today. I am really excited about doing this webinar and sharing the Building Active Communities Initiative with you. We call it BACI for short. And I'm Cathy Costakis. I work at MSU in Bozeman, but I am working exclusively with the State Health Department on a program called the Nutrition and Physical Activity Program. And today I'm joined by Meg Tracy, who's at the University of Montana. She can introduce herself as well, but she works also with the Department of Health on the Montana Disability and Health Program. And then I'm really excited, well, I'm excited for Meg too, but I'm really excited for Chris to be on the call today. He's one of our presenters at the Action Institute this year, and he works for Alta Planning and Design, a premier consulting firm for walking and biking. So, what I'm going to do is just give you a little overview of the project and then talk a little bit more specifically about the Action Institute and then the application process, and then turn it over to Meg and Chris, and then we'll have some questions and answers at the end. So, as we all know, Montana is a large rural state, and sometimes people think, well, we can't work on walking and biking things because we just drive. We need to drive everywhere, and everybody needs a car, and so why should we spend money on this kind of stuff? But as we all know, we all live in communities, and we live in some great communities where people, love to walk and run into each other and chat and shop and eat, and really, kids like to walk to school. People that have disabilities like to be able to access in their community like everyone else. And so we really do need to think about this in all of our communities so that everybody has equal access to getting around. And so we also spend, we also allocate a lot of space in our communities sometimes in our public space, which is our streets and sidewalks, and to a lot of pavement that maybe is not necessary. I mean, this is one of our downtowns in Montana, and I could probably land an airplane on this. I mean, I'm saying many communities are like this, where we've just somehow given too much space that is really not necessary, and we could just either narrow up these lanes a little bit and add some bike lanes, or maybe even at some point add some sidewalk and put some trees and things like that. So those are some of the things that we'll be talking about. So we need less of these kinds of things where we just haven't thought about the fact that other people will be wanting to walk or bike. And the lower left picture, you could say, well, who would want to walk or bike on this street? But you could see they do. And other things like just having some good policies of where signage goes, and making our sidewalks complete as much as possible. And so more of this. So when we look at the lower left, many of our communities have these great historic neighborhoods that have wonderful trees and big tree canopies and feel really comfortable walking on. But we tend to not do that in our newer communities. So we've really benefited from our forefathers thinking about what we would need in the future, and now we love those parts of our community. So again, lots of other great things that we're doing, building trails, crosswalks that, maybe if streets are way too long and we need a crossing in the middle of the street, we can do that. We know how to do that, like in the upper right. And then if we do have transit, make sure that the transit stop isn't just stuck in the middle of nowhere and not connected to a really good pathway that's accessible for everybody. So Melinda Barnes and I, we travel around the state a lot, and we were up in Havre and we were visiting there. It's a great community. And we were walking down a street, and this is, it's a great sidewalk. They try to put a little greenery in there, and there's a canopy overhead, and it's great. But when we turned the corner, we saw this. And it just gives you that completely different feel. I mean, the windows are a little bit lower, so you can look in, and there's trees, and there's cars that are parked, and a little more of the pots. And so it just gives you a feel that I like walking on this street. I'm comfortable, especially if it's 90 degrees out. So you can see that, just a little bit of effort and maybe policy around some of these things will turn into a completely different feel. So the other thing is we have small towns in Montana that are really ideally sized for walking and biking. And some of our communities are only a couple miles, across. And so we maybe, an average walking trip is half a mile, and an average biking trip is around 2 miles. So it geographically, it really makes sense for us to make it more safe and accessible for all people to take all kinds of different modes of transportation, if that's what they choose. But we do have some challenges. I mean, there's sometimes reduced capacity and expertise in local staff, and there's maybe a culture around, well, we just don't bike here, or we don't have enough money, or we've decided that we want to put our new development out by the highway interchange to attract more business, but what that's doing is really taking away from our downtown. So we have some challenges, but we also have some great opportunities. I mean, I've seen some amazing leadership in small towns where incredible things get done because there's such a close-knit group of people that work in these communities and care about these communities. So I'm very optimistic about Montana small towns and small towns across the country. So we've been working on this for probably about 12 years. It started with a Centers for Disease Control grant to the State Health Department for obesity prevention. And at that time, really, CDC realized that we've been educating people around healthier lifestyles for a long time, but the results have not been promising. I mean, we have unhealthier and sicker, heavier, and more costly people in our healthcare system, and they've realized that there's more to health than just health care. And so we need to work with other partners. Maybe we used to call them non-traditional partners, but now they're becoming more traditional. So can we work with downtown business associations or Main Street programs or the school district? Because all of these people have a stake in whether we can walk or bike in our communities. So we've had various grants. I'm not going to go through them, but in 2012 we got a grant called the Community Transformation Grant, and that's when we started the Building Active Communities initiative, and really worked with a bunch of partners around the state to craft what this would look like and how we would do this. And so the goal of it is to encourage policy and environmental changes that help make communities safer, more accessible, and more inviting places for people to walk or bike or take public transportation if it's available. So I'm going to talk about the Action Institute a little bit, and then some resources that we provide at the Action Institute. I'll talk about our advisors, and then a little bit about the application process, and then I'll turn it over to Meg. So this is just a picture of, we've had 5 different Action Institutes so far, starting in 2013. And we had a 1.0 where about 4 to 6 communities come and learn kind of the basics of this. And we've had a 2.0 where we've invited communities that have already gone through the 1.0, and last year we had 9 communities go through a 2.0. And it was more about implementation. And these are some of the BACI teams, and I just wanted to show this because it shows that we actually have fun when we do this. And on the lower right, I know many of you might recognize that last year we were in Great Falls, and we all went to the Sip and Dip, which is quite an institution. So we usually, spend time having some fun and connecting, because that's where we think a lot of great things happen as well, in the networking part. A really good part of, an important part of our Action Institutes are the walk audits. So we go out and we walk, and it's not necessarily to see the particular community that we're in, but we're just seeing examples and also learning how to actually conduct a walk audit. And so that when you go back to your community, you can gather some folks and walk your own community, and you have the skills to do that. And so these are just some pictures. In the bottom picture, we're actually making a human curb extension to kind of demonstrate what that would be like and how traffic could move around us. Sometimes we use public transportation, but it's always a teachable opportunity. So this on the right is Mark Fenton. He's come several years. He's great, and Chris is going to be doing our walkout at this year, and I'm really excited to see how he does his. A good part of the Action Institute is devoted to the teams putting together action plans so that when they go home, they actually know, like, okay, who are we going to reach out to? What do we actually want to do? How are we going to accomplish that? What's our timeline? What kind of resources do we need? Those kinds of things we like for you to work out when, at least a draft, when you're at the Action Institute, and then share it with partners and really ground truth it in your own community and say, okay, how does this work? And we can only really bring 5 people, really due to budget reasons, but we want you to go back and engage a wider team back home. We have several resources that we have developed, and we used to give you this big binder, but now we are a little more environmentally conscious, and we put it all on a jump drive, and you get it electronically. Everybody gets one, and we put all the presentations from the presenters at the Action Institute on those jump drives as well. So if you'd like to bring a computer to the Action Institute, you'd be able to put that in and see those right away. Then we also have a resource guide. So if you have questions about certain things, like you want to pass a complete streets policy, or you want to work on your sidewalk policy, or subdivision regulations, or a growth policy, or transportation plans, we put some of these examples around the state, but also from other places in sort of a resource guide. We also have a Montana Complete Streets Toolkit, which we did with Alta Planning and Design back in 2012, where it talks about, like, what are complete streets, what are the benefits, but also what do they look like? What do they look like in Montana? And also some case studies from various communities in Montana and what they've done and how they've done it. So we have been very fortunate to have some great partners in doing this, and some of those are the Department of Commerce, so their Community Technical Assistance Program, or their Main Streets Program, the Department of Transportation, the Department of Health, Fish, Wildlife, and Parks Rec Trails Program. The Western Transportation Institute has a small urban and rural livability center, and we work a lot with them. Meg is with the Montana Disability and Health Program, and I think most of you might know Melinda Barnes at Bike Walk Montana. Alta Planning is one of our consultants or advisors. Future West is a small nonprofit in Bozeman that works on land use and growth issues. We have Flathead County Public Health Department and other, city engineering and actually MSU Extension to also advise us, so we know that we're really doing the right things, that actually, we're not sitting up here at a state level and saying these things, that we're really sort of ground truthing it with local departments. So we've had a lot of success from the communities that have come. 16 communities have attended so far, and as I said, 9 of them came back again. And they have done anything from growth policies or transportation plans that they've really added strong language in terms of walking and biking. They've passed policies or resolutions around an intention to build all of our streets for all users. And some of them have called that complete streets. Some of them have called that safe and accessible streets. We don't, it doesn't matter what you call it. It's all about the intention of really building your community for everyone. And so, and we've been really excited lately that many of the communities have been doing active transportation plans. And that's one thing that we really like to encourage, because it really gives you an opportunity to outreach to your community and understand what the needs are, but also do some planning around, okay, where are our priorities? We can't do everything at once, so how are we going to go about prioritizing what we need to do? And if you don't have a plan, it's hard to do that. And also, if you have a plan, anybody that's working in your community can see that plan and say, oh, for this street, this is what they have planned for this street, so we should abide by that, or we should try as hard as we can to work with them on these things, because they've actually worked hard to get community input and put that into writing and get it passed at the local level. So, Park County, as an entire county, did an active transportation plan recently. Red Lodge just had theirs approved, and Whitefish, I think, has a draft and pretty close to being approved there. So we're really excited about that. Johnson County had got some national recognition for their complete streets policy. They were ranked number 3 in 2014 with over 70 policies that have been passed in the country. So our main goals for the BACI project is to really improve health through multi-sector collaboration that focuses on policy, systems, and environmental change. And so what I mean by that is that it happens by design. We build our communities that kids can walk to school, and people with disabilities can get around, and seniors feel comfortable walking to the grocery store or wherever they need to go, and people that might want to ride their bike to work can do that. So what do we need to do to put the framework in place for that to just happen? And that's through policy and planning. And we also look at what the research is and what's happened in other places, but we really need to bring it back to the local context, because Montana, it's very similar to a lot of places across the country, but also it's very different. And so we want to make sure that it works in the local context, and it's not a one-size-fits-all. Some places a sidewalk is appropriate, some places it's a gravel trail that's appropriate, but we just need to have those safe facilities. And then we really want to work on enhancing your efforts at the local level by being better about coordinating our own work at the state level. So that's why we've partnered with the Department of Commerce and Transportation and state parks and the Department of Health and others, because we all have different programs and agendas and resources, and we want to make sure that we're all working together so that we don't create any barriers for you to actually access some of this good stuff. So getting to the application, we need for you, in order to apply, to have a team in place, not necessarily right now, but you need to identify 5 people from multiple sectors, and I'll go into that in a minute. You need to do some pre-work, which is not onerous, but you'll have like 3 months to do it. It's really just meeting as a team, understanding some of your issues in your community. We'll send you some maps from the Department of Transportation so you can sort of map out where some of your destinations are, some of where people live, and kind of where the connectors are, so that you can say, oh, these are some priorities that we need to look at. And we'd like for you to go walk or bike in your community, just to get an idea of what your issues are, so that you come sort of prepared and understanding your issues and having met your team members at least, and have an idea of what you want to work on. And then attending the Action Institute, developing your action plan, and then we ask you to complete some evaluations. We ask you to follow up, if we can call you and do some follow-up, at least quarterly, and provide some technical assistance if you need it. That's not mandatory, but we really would like to be able to, and people have found it to be really helpful. And occasionally we'll have webinars like this if we find a subject that everybody's interested in. And then yearly, we'd at least like to go see you yearly. And many of you we've already met, but we want to meet everyone. So we like to come to your community. So, and I think I'm not sure if I mentioned that this Action Institute is in Butte this year. So Butte, May 16th to the 18th. I don't think I actually said that, but it's all in our, it's on our website, and I don't think I even have that in this presentation, but if you Google Building Active Communities Initiative, Montana Building Active Communities Initiative, it will come up, and you'll get our website, and it has all the information. It has the application. There's a PDF of the application if you want to just print it out and talk about it with other people and maybe fill out a little things, but you actually have to get online and put the application online when you're finally ready. So the team, we really recommend multi-sectors. So we love someone from the local government, someone from the health department or the hospital or a health clinic. And then, those are the two that we really are interested and want to see. But and then the rest you can decide who's the best. We've had superintendents, we've had mayors, we've had county commissioners, we've had public works directors and planning directors. We've had Downtown Business Association executive directors. We've had nonprofit organizations that are influential in the community, or just even community advocates that are just somebody that will be a great team member. So it's really up to you, your 5 people, but we really don't want to see like 5 people from the local government. So that will be something we really score on the application pretty heavily, is the diversity of your team and the high-level leadership of your team. Because we really want you to go back with a lot of power to get something done. We've learned that that's really important, the team makeup. It also is important as to who you choose to be your team lead. So we want someone that's going to take some initiative and bring the team together and kind of move you through your action plan. And that's the person that I'll be talking with the most and sharing information with. And I might share a lot of information with that person, and then they will decide kind of how that gets spread out to the team, because some things I share maybe won't be applicable to your community. So we really like to see someone that is going to take a leadership role to be the team lead. And we focus on peer-to-peer learning as much as we focus on having your team, gel and work better together when you're at the Action Institute, because we've found that there's so many communities that are so similar in Montana, and some of them have done great things in one area, and they can share that with others. So networking at the Action Institute is really one of the biggest things we like to do. We like to connect you with state resources, like I said. So the Department of Commerce may have some grant opportunities that maybe you didn't know before could be used for an active transportation plan. So we like to point those out. In fact, we have an active communities toolbox that we'll also share with you that really puts in one place all the things that the state has to offer in this area. And follow-up is critical. We really want to follow up with you. We want to provide technical assistance, not only from me, but Melinda and all the people on our advisory, all of our BACI advisors can be resources for you. And a lot of them will come to the Action Institute, actually, and you'll meet them there. And you'll be able to ask some questions there as well. And we have a BACI newsletter that we send out, and we share successes and challenges. And we also have a lot of fun. So we really hope that you come, and we hope you apply. And this year we think we'll accept up to 6 teams, and really that's based on budget. And really we also like to keep it a little bit smaller so that we can give you more individual attention. But we do this every year, so if you don't make it this year, we can look at it next year, and we can always come to your community as well and just talk with you about some of these things. So please apply, and I look forward to your questions after we talk a little bit. Here's my contact information. I think some of you, it's all over some of the materials that we're providing. So hopefully you have my contact information. And I'm going to then turn it over to Meg.
Thanks, Kathy. This is Meg Tracy, and I represent the Montana Disability and Health Program. We're one of 19 states funded by the Centers for Disease Control and Prevention. We're funded at about $300,000 a year. There's some variation there. We're actually funded 2016 through 2021. So we're in the beginning of a 5-year cooperative agreement, but our program really started in 2002 and was built on a lot of work done in Montana with our communities to define health with people with disabilities. And I really underscore that Montana really led in the understanding of health as distinct from having a disability within the public health field. And so there's a lot of partners in the state who are to be recognized for our leadership nationally in this work, and our ability to partner with Cathy Costakis in the Nutrition and Physical Activity Program so effectively. We've really focused on strengthening public health efforts through the inclusion of people with disabilities over this time. And that perspective really brings with it that the community that lives with disability or the community that provides services with disability is a strength in our communities. So it's, yes, there are unique needs that people with disabilities have, but there are, more importantly, strengths that can be brought to community development and promoting the health of the community. Next slide. So I just want to briefly review how our program can help with your community's BACI application. Most specifically, if you are looking for a disability advisor to recruit to your community's multi-sector action team, so that you have this kind of 360 perspective, this inclusive perspective in that pre-work that Cathy described, and it is more fully detailed in the RFP that you guys will be responding to. Just be thinking with me as we review this, as if your community team is doing an assessment of the safe walking and bicycling conditions and connectivity, such as active transportation and recreation infrastructure in your community, how does that differ when someone who's really knowledgeable about disability, that's their lived experience, and they have particular training in solving these issues for people with disabilities? Maybe they're a bike enthusiast who has paraplegia, and they've really thought through how they're going to bike in your community. What perspective will they bring to that assessment if they're a part of your team? Or if they are a director of the Developmental Disabilities Program and they've really been thinking about how to support employees to bike to their workplace when they have an intellectual disability, they're going to bring a really different perspective to that assessment and an important perspective. Similarly, when you're thinking about creating your presentation for the Institute, what contributions would somebody representing the disability community bring to make that presentation of the strengths of your community and some of the challenges you guys have more representative of the whole community, including those who live with disabilities? And finally, that other piece that's prior to the Institute for communities to complete is a simple place mapping and connectivity exercise. And again, I provided the link to the PDF version of the online application that you will have to submit online, but those quotes above are directly from the RFP. So just wanting to underscore the importance of having someone with a disability on your team as you go through this preparatory work, and that it really isn't an afterthought, that that perspective is important even from the very beginning. Next slide. So the type of support we can provide to BACI communities, either those attending the Institute or those who are already working in their communities towards active transportation, include community and public health data. If you're writing a grant, for example, or you're developing a plan, our program has good public health data as well as community environmental data on accessibility. An example we have are the county profiles that we've created for emergency management teams who are required to take this whole community approach in planning, preparation, and recovery activities for emergencies in your county statewide. They have to be thinking about the whole community and including people with disabilities. So we've really detailed the population data that's available for people who have access and functional needs that include people with disabilities. And I've included a link there to those county profiles. And we've just updated those, so I can, if you want the most recent data, you can email me. And I can also, our program has lots of data describing the health disparities experienced by people with disabilities. And I'll just, as an example, point you to the 2014 Montana BRFIS annual report. We work closely with the BRFSS to take the data that's available through that annual survey supported by the CDC to make sure it represents not just the health trends for men and women, those in different age groups, American Indians, but also to represent those health trends for people with disabilities. And there are a number of health disparities that are very relevant and may be addressed by activities pursued for active transportation and healthy communities work. And finally, I'll just say we have lots of resources. The toolkit that Cathy talked about earlier includes a whole set of resources for building a more accessible community and really thinking about the ADA as it's operationalized through the ADA codes, but also through those guidelines that are emerging out of the ADA task force within the Department of Justice, so like PROAG and other guidelines that aren't necessarily law or mandated, but certainly are best practice and are opportunities for communities to be thinking about a future where their community members who live with disabilities and being more active. We also have resources on information about grants, small grants, bigger grants, and going back to the disability advisors, a lot of the disability community has experience pursuing small grants, and we certainly would be wanting to help if your community was interested in working towards some additional funding for accessibility. And then if you have a person who's maybe not comfortable being a part of the team yet, but has that promise and they just want to have a little access to some training to serve on your team, we certainly would be wanting to connect them to some training and really helping them to build their capacity to contribute. And that's really all I have to say. I wish you guys the best in preparing your applications and just want to encourage you if you need anything from our program, we're here.
Great, thank you, Meg. I'm just going to bring up Chris's presentation now. And Meg and I have worked together for many years, and I just want to say how much I've benefited from her knowledge and to make me think. I mean, a lot of times we just go about our day and we don't think about how it is for people that don't have, all the abilities that some people have. And it's a really it's a good perspective and an important perspective. And Meg is always somebody who helps me understand that better. So thanks, Meg. Okay, so Chris, you're on.
Thank you, everybody, for coming aboard and listening to this discussion today, and hope to see many faces in May. And thank you, Cathy. Cathy is on my sort of professional Mount Rushmore in a lot of ways, and appreciate the opportunity here. So I wanted to talk to you just briefly about my experiences and sort of get you thinking about why and how to get started with respect to active transportation, specifically in small towns. My experience has most definitely been inclusive of smaller towns, rural towns, all the way from a community of about 150 all the way up to a couple 100,000 and everything in between. So let's go ahead and go to the next slide. So why does this stuff matter? I wanted to go into just a few things first with respect to just kind of the overall picture of why would this training be helpful to you. First off, we are officially living shorter lives. If you didn't see that in the news, I think it was about a month ago, it's been discussed in the health sector for quite some time that we would be facing this, and it is now upon us, where just last month it was noted that we now are, as humans in America, living about a month less than what we were, say, 30 years ago, and that's not a good sign, especially with all of the advancements in medical technology and all of the awareness that we have. But something is amiss, and something is wrong, and being active and moving is certainly a part of it. Our waistlines continue to grow. Yeah, absolutely. It's often cited as if with people, especially walking back and forth to school, is an area that is definitely been on our radar for quite some time. The amount of folks who are walking and biking to school has plummeted, and unfortunately for a number of reasons, from our built environment to lack of infrastructure to even things like stranger danger and perceptions and so forth. So, but being physically active is one of the most important ways to prevent ourselves from getting out of control with regard to our weight. And right now, almost 3 out of 4 Americans fall into the category of being overweight or obese. So yeah, this is a part of it. especially in rural communities too. Active transportation equals freedom. In that particular realm, what do I mean? Well, the first way we get around as people is by walking, right? Bicycling, for example, is what led roads to being paved. Many people don't know that, but you go back 120 years ago, and that's kind of how roads started to become more and more paved, was because of an interest in bicycle clubs and their advocacy to get those things smoother and smoother. But freedom in the sense of, especially with regard to things like equity, if we can't provide folks an ability to walk back and forth from their home to their place of employment and other places, we're missing the mark. Think about service sector providers, service sector workers, for example, who might get off at 3 o'clock in the morning. Well, they're forced to walk home in some cases at night and in dark and in poor conditions. And so that freedom of getting around is a very important theme to being active, and specifically around active transportation. It's good for your economy, absolutely. There's so much data around this, and especially around trail design and trail implementation. But the more a community has with respect to infrastructure around walking and biking, the more investment will come. The more people will want to be there and spend time there. And you look at a town like Whitefish, I think that Cathy just mentioned, who they recognize that, for example. Even though they are a resort community and a desired place, they still know that there's room for improvement. So they're moving forward on that. And what's old is new again. There is a bit of a growing trend with regard to especially our younger folks, and that is that they want to live and work in places that are more physically accessible by walking and biking, and not always having to rely on a car to get them back and forth. I personally have worked in communities where I've had schools and cities tell me that they are discontinuing driver's ed for kids because they can't get enough people to sign up for it, which just blew my mind. But nonetheless, that's the world we're living in a lot of places, and that's happening in my state and probably in yours. So next slide, please. So the takeaways that I want to provide while I'm up there are a few things. Start with what you know. Here's a slide. If you haven't been on the Active Living Network, this is a good research, this is a good website to go and explore. And so here's just a few infographics that kind of can help. And when we recognize and look around at our communities and we say, okay, who's walking and where are they walking to? Well, we know that 60% are for recreation, 40% are for shopping, and even 46% for school and church. But also look at the distances. Those percentages drop off precipitously after 1 mile. So focusing in on a closer distance right away to build momentum is key, but understanding first where those destinations are is critical. I often say, if you can't walk from your house to a park, we're failing you as planners, as public work folks, and all the folks that are involved in that particular realm. Next slide. Other things, for example, here you go, when it comes to the physical activity part, trails, here you go, people who live near trails, 50% more likely to meet physical activity guidelines, absolutely. It doesn't mean that it has to always be curb gutter sidewalks, for example. We can get places via maybe some sort of a trail. I've seen in lots of communities here in Idaho, rural communities included, where a side path type of a trail is often constructed rather than doing full-on curb gutter sidewalk because of cost. And so folks who live closer to those things are much more physically active, and that's important. So again, I would encourage you to go to Active Living Research and take a good look around, and you'll see some of these things and give you more specific regard to data and percentages and research that prove some of these points. Next slide, please. It doesn't have to be hard. These pictures I'm showing you here is from this is in BACI, Idaho, population 500. We were there a few years ago, and they had a problem. The problem was they had one school, and a lot of people who were driving to that school were coming down one road that you see pictured that was just nothing but asphalt. And they were having a hard time with speeding and walking and all these things, and we started off by telling them, you need to just simply stripe the road. And they were in disbelief, including the mayor. He didn't want to believe that. But we said, this is a place to start. It's not the end, but this is where we want to start. So what we saw, that guy in the upper left is the public works director. He's also the head of the volunteer fire department. and he's also the baseball coach. And what he's using to stripe that road is what he uses to stripe his baseball diamond. And so he went out, measured all these things. He actually put 9-foot travel lanes out there and created a shoulder, put in some crosswalks and some additional signage. And the next thing you know, the walking rate for kids went up through the roof. And also, more importantly even than that perhaps, was that vehicles, motorists specifically, slowed down. And that's exactly what they wanted. So in this case, it was simply the utilization of paint. It didn't require some major investment initially. So it's a good way to get started. So there are ways to get moving and get momentum built. Next slide. The final takeaway, and this is so important, is about opening your eyes. And I love particularly doing walk audits or bike audits, and I think it's so critical that we get out, especially if you've lived in the same community for a long time. It's helpful to bring people in to bring a fresh perspective and see some of the things that maybe you have seen over and over again, but for whatever reason it's just kind of become the norm, right? So if you see some of these pictures in the upper left, that was with the Utah Department of Health, and the lower left up in Coeur d'Alene, Idaho, just doing walk audits and making sure every single person sits in a wheelchair. That's so important. In the upper right, the guy with the orange vest is actually the mayor of Cascade, Idaho, population 900. In that instance, we went out on bikes and just took a good look around and kind of pointed some things out. And so when we do the walk audits up there for the training up in May, it's going to be really fun and something I think that you'll get a lot out of. And then on the lower right, something you can do right now, I would encourage all of you to do this. We've done this in a number of communities. Go out and ask kids to draw their walk or bike to school and see what they come back with, and tell me that that's not an eye-opening experience. You see that image right there. I mean, it doesn't get more raw than that. Get out of the road, rum, the vehicles are just, that's a child's perspective in front of a school zone. If that doesn't get the attention of your city leadership, I don't know what will. And next slide. So I'll leave it at that. I'm really excited. I think that the curriculum is going to be not only certainly educational, but also fun, and I'm really looking forward to it. So stand for any questions you might have.
Great. Thank you, Chris. That was fabulous. So Amy, I don't know if you want to just start a question answer, or there are some questions already?
Okay, so I'm going to go ahead and unmute everybody's line. Just as a warning, if you have music on or anything or a noisy background, you'll want to mute your line. So I'll do that right now. And then we do have a couple questions in the chat here, so I will read those in just a moment. So I'll go ahead and read out the questions that came into the chat box aloud, and then we can go to questions from you guys. So for Donna, the recording, I'm hoping to have it online by this afternoon. So I'll share the link with you guys, and you can access the recording. And then she's also asking if she can use the recording for a community and public health nursing class at Carroll College. Is that okay, Kathy?
That's fine with me.
Okay, perfect. So I'll share that link, and then we have another question. Does the BACI website have info from past projects? I searched the site for a specific town and didn't have much luck.
I'm sorry, say that one more time.
Does the BACI website have info from past projects? I searched the site for a specific town.
So look, we don't have a search for a specific town, but you should look at the BACI newsletters. So we have a section of our website where the newsletters are. It might be under the resource page. I think it might be under the resource page at the bottom. So look for those, and those will kind of tell you some stories about what's happened, and hopefully will be. But one of the things that we do at the BACI Institute is that all the communities get up and talk about their towns and about their stories. And so that's one of the more positive things that happens.
Okay, and then does anybody have a question they want to ask over the phone?
Hi, this is Butte. Todd and Kathy are here today. Wait, you guys.
So we did have a couple of questions. We had invited some of our city planners today, and unfortunately they couldn't come. I was wondering if you had any advice if they're planning to go, door to door and get some commitment and assistance filling out. Are there talking points you could send to us or give us so that when we go in it makes the most impact without, I guess, getting out of our own thoughts about why this is important?
Cathy, I'm sure we could talk offline, but I would just enumerate some of the things that even Chris talked about. That there are, there's lots of different sectors that can benefit from doing this. The business sector, the health, the health sector, keeping people healthy in your community, but also making your community more accessible, places where everybody can get around and have it's more of an equity issue. Some of those kinds of things, but we can talk if like Chris said, the Active Living Research website has a lot of research, so there's a research-based argument for all of this. If you want to get on there, they have a bunch of white papers that can talk about some of these things, but I'd be happy to talk to you a little bit more about how to sell this in your community.
Thank you. And then we were kind of throwing around some ideas about, getting, it seems in Butte, which traditionally has been somewhat difficult to convince that these are good ideas, that if it comes from the community, members of the community, it's more likely to go over. I think what's happening in our community is the city planners will try to create change, and then people that are adamantly against biking and saying that no one walks because we're on a hill, then there's a bunch of negative energy around that change. But if we can get some community members together, it seems like if it comes from us as the community, it's more likely to go over. Have you, I don't know, does anyone have any experience with that being a good idea?
I might let Chris weigh in, but I would say absolutely. I mean, the last thing you want to do is have it feel like it's something being imposed on your community. I mean, it's something that if your community wants this, there are people in your community that do want this, and I would just reach out to them and have them express what it means to them. If it's to a city council, or if it's to a community board, or if it's to the school district, wherever you need to. They, just, and kids as well. I mean, kids are a great advocate for some of these things. Chris, did you have anything to add to that?
Yeah, I mean, again, this is a common theme where, a lot of folks, unfortunately, with the planning realm, they feel like they're up against it and they're supposed to do all these things, and then they end up not getting the support because it's not rooted in grassroots. I would encourage you, again, look at that little idea of an art contest with kids. Start with that. That's so easy to do, and something that generally leadership can get around because it's pretty harmless and innocent. But then I would go out and do intercept surveys, and that's a fancy way of saying talking to somebody, going out, downtown by the university, or wherever, and just having a conversation with people, asking them 2 or 3 key questions about walkability or bikeability. And present and find all those things out, and then come about finding an approach that makes the most sense. There's a company out there that can do incredible phone surveys for about $2,500, and they'll have a report back to you within 10 days, and that's all community based. So there's a number of things that can be done that don't have to be from the top down, for sure.
Awesome, thank you. Just one last question, sorry. Can you provide 2 or 3 questions that you think are powerful, or is there a way to get somewhere to kind of narrow it down for us so that we find the most benefit in doing that? Because we are interested in doing that.
Yeah, I think we can provide that. I think Cathy and I we can talk and figure those out.
Yep, we'll get back to you, Cathy. Yep. Anyone else have questions? And Amy, I would just want to say a couple of things. Sure. I hope that everybody knows. I mean, I think I sent out a lot of information. I don't know if everybody on this website got that information. So if you want more information, just Google Building Active Communities Initiative, and it's usually the first thing that comes up. And then you'll get to our
our home page, and that's where all the information is about the application, and then there are different resources pages on there. We've put up a lot of presentations from past BACI Action Institutes. We have a ton of resources on those pages, so it'd be a good place to look for. Meg has provided a bunch of resources. Beth Shoemate from the Rec Trails program has provided some great resources. So I would encourage you to get to our website and also call me if you have any questions. I'd be happy to talk to you about the application. So the application is open now. It closes on February 10th. And then about, maybe a week or so, 10 days later, we'll let you know whether you've been selected. And then we'll assign the pre-work and work with you during that process, during that time, to get prepared to come to the Action Institute. And I would really recommend, you have to also, I should say, give us 2 alternates, your 5 people that you want to come, but also 2 alternates, because invariably people will have something come up at the last minute and they can't come. We really want 5 people from your community to come. And we're, as I hope we've said before, we're paying for your travel and your per diem, and we only pay for 1 car, so we hope we can all come together, but we all pay for your hotel rooms and your meals, and so it's all we ask is that 5 people show up.
I just want to add on that sometimes it does take additional resources for a person with disability to participate. And so that's, again, something if your community is selected, that our program also augment the BACI resources. So the 1 car may not be accessible. So we would, want to make sure that we thought that through with the communities that were coming and provided mileage for an accessible vehicle.
Thanks, Meg. That's a great point.
Perfect. Well, I shared the link to the BACI website there in the chat box, so if you guys want to save that or access that right now, you can click on it. And then also there's a link to where the webinar will be posted, hopefully by today, if I can get it converted to an MP4. So you can check back on that and then go through the slides or go through the recording if you wish to. So thank you everyone for joining. Thank you presenters for doing a great job. And I ask everybody to please fill out the survey at the end. Thank you.